in.
Hi, my name is Corrine Aguilar. I'll be your nurse practitioner student today. I'm in a class for WKU. I'm going to go ahead and wash my hands and put on my PPE. Okay, personal protective equipment.
Okay.
How are you, Miss Redmond?
Good, how are you?
I am doing well. Are you comfortable?
Yes.
Are you in any pain right now?
No.
No. Okay. So we're going to go ahead and start with your family your past medical history. Do you have any allergies?
No.
Do you take any medications?
No.
Do you have any allergies to medications?
No.
Do you have any allergies to foods?
No.
Any allergies to your environmental
No.
issues?
No.
Seasonal allergies?
No.
Are you sure?
Yes.
Don't have any seasonal allergies? No. Okay. And do you take any medications?
No.
Okay. Are your immunizations up to date?
Yes.
Do you go to school?
Yes.
What grade are you in?
12.
Do you have any surgeries?
No.
Previous hospitalizations? No. Chronic illnesses?
No.
Injuries or disabilities?
No.
Major childhood illnesses?
No.
Last menstrual period?
2 weeks ago.
Do you know if you had any birth issues when you were born?
I had no birth issues when I was born.
Okay, and when was your last period?
2 weeks ago.
And how's your mental health?
Good.
Do you see a therapist?
Yes, every week.
Every week. And has she diagnosed you with anything?
No.
Do you, have you ever had any blood transfusions?
No.
Reactions?
No.
Have you, had any physicals lately?
Yes.
When was your last physical?
July 18th, 2024.
Then now we're gonna go over your family history.
Okay.
So do you have any brothers or sisters?
2 brothers and 2 sisters.
And have they been diagnosed with anything?
One sister has ADHD and one brother has ADHD.
How's your mom? Does she have any medical issues?
Yes, she's pre-diabetic and she has ADHD.
All right, and what about your father?
My dad has ADD.
And you don't have any mental issues?
No.
Oh, okay. You should. And so your mom and dad both have basically ADHD, ADD, and
Yes.
your mom has pre-diabetes?
Yes,
And
and
then-
some OCD.
And some OCD. Have you diagnosed her, or is she really diagnosed with that?
She used to say it all the time.
Oh, okay. I don't think I'm really diagnosed with that, but anyway. So, next is your grandma. Does your
She's
grandma,
diabetic.
which grandma, from your mom or dad's
My
side?
mom's side, I don't know my dad's side.
Okay, and so your grandma is diabetic,
Yes.
and does she have any other issues? That you know of.
High cholesterol and high blood pressure.
Okay, and what about your mom's dad?
I don't know him.
Okay, and you don't know anything about your father's parents either? Okay, do you have a job?
Yes.
What do you do?
I'm a 5-year-old cashier and stalker.
How many hours do you work?
8 hours a week.
8 hours. Hard worker.
Minimum.
What, you said you were in 12th grade?
Yes.
As a senior?
Yes.
Are you married?
No.
Do you smoke?
No.
Do you drink?
No.
Do you do drugs?
No.
Do you have a religion?
Yes.
Where are you from?
Franklin, Kentucky.
How long you been there?
7 years.
So it's a small town?
Suburban, yes.
Yeah. Do you live in a home or apartment?
I live in a home that has 5 bedrooms.
And do you live with anybody?
Yes.
Who?
My mom, my little brother, my little sister.
Okay.
And our 2 kittens.
And our 2 kitties. That's cute. Okay. So you have a good environment, sounds like.
Yes.
Do you get all your fruits and vegetables, meat, dairy?
Yes.
Yes. So you eat healthy?
Yes.
And
don't drink enough water.
do you drink a lot of soda pop?
Yes.
Do you drink a lot of energy drinks?
No.
Good. And so would you say that you should cut back on your soda pops?
No. More like sweet tea.
Oh, just your sweets. That's actually a good idea. So you get good nutrition. What about your fitness? Do you work out daily?
Yes.
What do you do?
I have weightlifting for 60 minutes a day at school, and then on Mondays and Tuesdays I dance.
Okay.
3 to 4
And
hours.
what would you say your sleep is like?
I get 5 to 7 hours nightly.
Okay, so you would try to increase that to 8 hours. It's the best, but 5 to 7 isn't so bad. Are you sexually active?
No.
If you become sexually active, make sure you protect yourself.
Always?
And are you concerned about the cost of care here today
No, I have
for
insurance.
this physical? And have you traveled outside the United States?
Yes.
And what about in the last 3 weeks?
No.
No. Okay. So that is your past medical history, your family history, and your social history. And we'll just get right into it. So I'm going to check your head first. And here I'm looking at it. It is symmetrical, and it seems to be a regular size, or within normal limit size. And it's quite round. I'm looking at her scalp. There's no parasites, no lesions, no dandruff. Her hair looks well taken care of, well manicured, or well taken care of. Anyway, hair looks great. So your head looks great. And now I'm gonna go ahead and look at your face. And right here we have the eyebrows, which are symmetrical. She has no lesions. There's no crusties. She looks clean, well taken care of. She's got small adolescent acne, a rash on her chin. Her lips are a little crunchy across the bottom, and it looks like that maybe from the rash as well. Are you using any new products?
I used CeraVe last week.
Okay, so hopefully this will clear up on its own. If not, we may need to send you to a dermatologist. And then I'm gonna go ahead and look at, so I don't see any lesions. Your sclera is white. Sorry, I didn't mean to do that. Your sclera is white. I do not see any discharge in her lacrimals, and everything looks moist, intact, and pink. So if there was any issues, you would see maybe some lesions or some like broken blood vessels. I don't see any of that. So I'm gonna go ahead and take a look at your ears. So we have the tragus here, and I'm pressing there. Is there any pain?
No.
Is there any pain?
No.
Okay, so the tragus has no pain. The pinna looks good. It looks like she may have had a past piercing in both ears, and then her auricle, both of them are symmetrical, and no lesions. No discharge from the ear. We're gonna go ahead and check it out. And from here we can see that I'm gonna pull her ear down here, since well, she's got more of adult ears. She's almost 18, so I just did pull them up and out like an adult. And I see her eardrum, I see a light reflux, and I see her it's not a stapes, malleus. Oh, we'll get you another one. So her malleus looks good. And then we're also gonna look in the other ear. I didn't see any earwax buildup, and it looked all pink on the skin, and it was like the grayish white color on the eardrum. So we're gonna look over here for the light reflex. So we see, oh, there it is. There's the light reflex. It's gray. There is a malleus, and there's no, oops, sorry. This is so I'm sorry.
Stab me that
So
time.
I didn't mean to stab you. Did I actually stab the eardrum? Well, I don't feel like I was that far in, but I guess I was. Okay. So I did see the eardrum. I saw the malleus, and I saw the light reflex. And so we're also gonna take a look at her nose right now, just to see if there's any septal deviation or any redness or swelling. That nose, there is redness and swelling, but it looks like the septum is good. There's no deviation, but there is some redness and swelling in both of her noses. Her noses. This is the olfactory, and this is how she smells. So to test the olfactory nerve, I would have her smell something. We're gonna look at your mouth. Oh, we're gonna look at your mouth. Go ahead and open. I'm gonna just put your tongue back in. Just keep it open. So I'm looking at her teeth. I'm looking at her teeth. They look great. Her gums look pink. There's no lesions. There's no tears. Gums look healthy. Teeth need brushed. Do you brush your teeth twice a day?
No.
Oh, well,
Once
you
a day.
should. Okay, go ahead and open your mouth. So, there's a gag reflex there. Go ahead, look up. I'm gonna look at the top of your mouth. Okay, no lesions, no discharge. Looks good. Did you burn the top of your mouth?
A while ago.
Oh, you can see it. Okay, there's like a little scarring there. And then, her teeth look good, no lesions. There's a couple of cavity feels, but other than that, I don't see anything concerning inside her mouth or the top of her mouth, and her gag reflex. So her vagus and glossopharyngeal nerves are intact, and her acoustic is intact, because she is answering all my questions correctly. But I'm gonna go ahead and make sure that you can hear correctly. Cover one ear. Okay. You're covering that one ear. I'm gonna say a couple of words. Let me know what you hear.
Okay. Orange. Watch. Right. Rain. 3.
Okay, we may need to get your hearing tested. Okay, other ear. We're gonna say a couple more words. Can you say
What? Coffee. Rain. Green. Rain.
okay? So we may get her to go get a hearing test from a specialist later, just to make sure she can hear okay. Maybe she's a bit distracted. So we got her head, we got her ears, we got her eyes. We're gonna go ahead and check your eyes out. And so is this on?
No. Mom, it's at the top. It's at the top of the other line.
Oh. Okay. Okay, so we're just gonna check your eyes. So basically we're looking for them, look at me. So basically we were just making sure there was direct, which happened in direct in her right eye, and then indirect in her left. And then I switched over and direct happened, and so did indirect in her right eye. So we have indirect and direct constriction or dilatation in both eyes. And then now we're just gonna go ahead and I'm gonna look to see if I can see the veins in your eyes. Go ahead and look at that door handle. No. There are the two veins. And let me see the other eye. Look at the handle. Look at the handle. And I see the two veins. Okay. And there's a piercing in the side of her olfactory on the right side. So her eyes are perla for the most part. We have a couple more tests to do to make sure you can see okay. So we're gonna do this 14 inches away. What is those last letters?
428739.
Okay, so your vision with the Snellen is good. Before you came in here, my tech did the vision out there 20 feet away, and she told me your vision was 20/20. So you can see well.
Okay.
And then we're gonna take some more tests. This is basically testing optic nerve. The optic nerve is sight, which we just did with the Snellen test. Then we do the ocular motor. So you're gonna just follow my fingers. Why didn't you follow both of them? Could you imagine if you could do that? Okay, just follow one finger. And this is the cardinal of sixes. And basically we're seeing if her eyes have nystagmus or not. And in, and in. And there's a word for that, but perla. Her eyes perla. And then also I'm gonna have you, while we're in it, I'm gonna have you do the wiggle. So when I wiggle, you just say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
How many fingers am I holding up?
On which hand?
This one.
3, 2, 3. I can't see that low. 3, 4, 2, 2, 1, 3, 2.
Okay, so you can see pretty good.
Yes.
Okay, so your eyesight is good. Now the only last thing I'm wanting you to do is to take your finger and touch my finger from your nose. Touch your nose, touch my finger. I'm gonna just use one hand for you, sorry. That was a little bit confusing. Slow down, ma'am. Just take your time.
You're the one going fast. Quick move.
Okay, so you can do that. Go ahead, and now we've tested your eyesight, we've tested the ocular motor, we've tested the trochlear, which is the in and down, and then we've tested the peripheral sights. But what is it called? This is called, there's a trochlear and an abducens. So your abducens is what we test of when you look to the outside and look to the outside. There you go. And then the abducens. And then we would go ahead and do the other facial. The facial is number 7. So we're gonna go ahead, lift your eyebrows, close your eyes real tight, smile real big, show your teeth. So that's the, okay. So your trigeminal works. There is 3 sections, right here, and then the jaw. Go ahead and open it. Clench your jaw. Clench your jaw again. Clench. Okay, so you've clenched your jaws really well, and so we had the acoustic. We've now tested with your gag. It was the vagus and glossopharyngeal, and you could swallow. Well, you'll be able to swallow when I do that the thyroid check. And so, so now we have everything to 8. 9 is your vagus and your glossopharyngeal. 11 is your shoulders. Go ahead and shrug against me. Go ahead and push against me. Okay. And then 12 was your gag, was the motion of H. Go ahead, stick your tongue out and do the H. Okay. And then make your cheeks poof and put your tongue on both your cheeks. Good job. Okay, so that's basically all your cranial nerves right there. The vagus is actually a huge nerve, and it goes down into your abdomen, and it deals with digestion, and it controls your heart rate as well. So sometimes when you have vagal stimulation, and your heart rate can go down, and sometimes pass out. It's vagal stimulation. Anyway, so now you know that. So now we're gonna go ahead and test her lymph nodes on her face so that we can get through that. So I'm gonna just do a little palpitation here and here for your sinuses. Does that hurt?
No.
Does this hurt?
No.
And then we're gonna do the pre-auricular, the post-auricular, the tonsillar, the occipital, it's in the back, going down into her post cervical and her anterior cervical, her submandibular, and the submental, and then it's the supraclavicular. So you would only feel these if she was really sick, but all of these, there's no swelling, no pain, no tenderness. All of her lymph node system feels good. And then we're gonna go ahead and move into the thyroid. So she's got, go ahead and swallow for me. Okay, so it feels symmetrical. It looks symmetrical, it feels symmetrical. I'm gonna push it to the side here. Yeah, go ahead and swallow. I know it's hard. Okay, and then I'm gonna come over here and do the same thing. I'm gonna push it to the other side and feel with my fingers. Good job. So that's your thyroid. It feels symmetrical. There was no pain. And also I'm gonna go ahead and at that point I would feel her carotids. Okay. And I would listen for a bruit. Okay. And then on this side, I would feel for a carotid. And I would listen for a bruit. Okay. So she has good bruit, and both of them seem to be working well. Stop. So,
She's doing my
looking
facial.
good. Okay, so now I'm gonna have you do range of motion of your neck. So you're gonna put your chin up, your chin to your chest, chin to each side of your shoulder, and then go ahead and touch your ears to each shoulder. And I think I forgot to actually push your shoulders up. I don't remember doing that. I did. Okay. So and that's just your spinal accessory. I meant to say that, but it's your spinal accessory. What?
Mom.
What?
Never mind. I think it still went.
It's still going?
Yeah.
Did you stop it?
No, low power mode.
Man, it just about had a heart.
I hope it videoed.
I hope it lasts. Okay, so let's try to
Yeah.
hurry it up, but not take too long. Okay, so I would go ahead and at this point, I would probably still listen to, let's just keep it the same. Go ahead and go back. So we're gonna just go ahead and look at your axilla to look at your lymph system there. And there's actually a lymph system in here. I would check all of that, and I don't feel anything. It looks good. There's some axilla pubescent hair So there's that, and then I don't feel any lymph node swelling. There's no irritation. Is there any pain?
No, you're just tickling me.
Oh, okay. And then we're gonna go ahead and do the other one, and so we have no swelling, no pain, no irritation. And I'll even come up into this middle here and feel, I don't feel any. There's that. There is a little lesion right here on her forearm. Looks to be healing well. And so we're gonna go ahead and do, sit up for me. We're gonna just do the range of motion on, this is your, I should have went over this.
You did.
I did. The acro. Jeez. I know that this is the superhumerus, or it's there it is. And then there's the acromyine. Anyway, and then back here is it's to your shoulder bone. It's another point right here to your shoulder bone. And all three of those are just points for us to know to see if those are all okay, and just to make sure they're connected correctly, and also there's no lymph issues in this area as well. And there's good, she can lift her shoulder well, and her she can go ahead and move it up and put your hands in, both hands in, down. No, I think we're gonna put it out and down. There you go. And then go ahead and put your hands out. Stretch out your fingers. I'm gonna go ahead and check out her fingers and her nails, and they seem to be no lesions, except for on her thumb here, a small little lesion. They seem to be well taken care of, and just have old nail polish on there. They seem to be symmetrical. Turn your hands over. Symmetrical. Go ahead and push out, and then grab both. Good job. And then we're gonna go ahead and you push out again. Okay. And then I'm gonna push down with your, okay, and grip your hands together. Okay, and push up. Okay. And then we're gonna go ahead and, so we have good range of motion, and good job. So when we're checking this, it's just to see the motion and make sure that she can go to the posterior, and her hands are actually out, and then up here her hands would be in. So so she has good range of motion on her arms. There is a small lesion right here from what looks to be a scratch, and the same here. So they're all scabbed over. Probably has a cat. Okay, so that's good. Now we're gonna listen to, actually just lay back for a second. We're gonna listen to her lungs. She's got that down. Okay, go ahead and put your legs out. Okay, so we're gonna listen to her lungs. First, we're gonna go ahead and palpate for tactile firmitus. Tactile firmitus, and basically it's just air underneath the skin. I don't feel anything anywhere. Okay, no feeling issues here. And when we get to the back, we get to the back. Right now we're just gonna do the percuss, and so I would have her move this down, just hold that down there. Oh, that sounds good. Okay. Okay, now go ahead and and we'll come over here. There, I had a hard time with that one. Okay, we'll start at the top with this one too. And I'm gonna just go across here. Actually, it's gonna be more. And we're just percussing. And note, it sounds different than on the bottom. So I'm gonna auscultate her chest and then her abdomen before I move to the abdomen. So that was her percussing of the chest, and I'm gonna go ahead and listen to her with the, I'm listening to her heart first. So we're gonna go to the V2, the second ICS, and that is right here and right here. So this is the V2 on the right, and this is the V2 on the left. So on the right, we'll be listening to the aortic valve, and on the left, we'll be listening to the pulmonic valve on the second ICS. On the third ICS, we'll be listening to the second pulmonic. On the fourth ICS, we'll be listening to the tricuspid, and on the fifth, we'll be listening to the mitral valve. And so that's what we would do right there. And then we would also turn it over to listen for murmurs. So we would use the diaphragm on all of those spots, and then we would use the bell on all of those spots. And then when we listen for her breathing, we're going to auscultate on 6 different areas of her front and 6 in the back. So we're gonna percuss here and here and here and here and here and here. And so we would percuss those 6 areas and palpate those 6 areas, and then we would do her back. You have a seat up. Okay, and then back here we would check it out. There seems to be some adolescent acne on her back. No lesions, no, her back also looks symmetrical, all the way up and down. Does any of this hurt?
No, except for at the very top.
Okay, right here. Okay. And then, so we have all of these little bones, making sure those don't have any tenderness and they are straight. And they are straight. And then we would listen to her bruises on her neck. So carotid right here, we have the right carotid, and then we have the left carotid. Both, we would only do one at a time, and all I would do is feel to make sure, and then I would listen. I will look at that in a second. I will listen to the carotid and hear if there's a bruise. After I check it out, she just turned her head a bit, and you could see if there's any distension or overload or anything like that right here. And you feel it, and you can feel the pulse, and there's a regular rate and rhythm. And then you would listen for the bruise. And then I would go to this side as well. I would take the pulse. There's a regular rate and rhythm, and I'd listen for the bruise. Okay, so now we're on the back. I'm gonna go ahead and auscultate. I'm gonna go ahead and auscultate these 6 spots right here. So sit up straight. And so this is just her breathing in deep. I will listen here, here, and here, 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 and here. And that would be with the diaphragm of my stethoscope. And on the shoulder, we would test both sides since she has 2 arms. And then again, I did the spine, and I'm gonna move to the abdomen. So I would listen first to see if I could hear any sounds, and I should. within the first minute. If I don't hear anything within 5 minutes, it is called absent, and I would probably need to send her to the ER because there may be a blockage. And so I would listen to all 4 sides and listen for vowel sounds. I would palpate all 4 sides. Here I would be looking for the liver. Go ahead and breathe in deep and then out. That's right there. And then on this side, I would be palpating, breathe in.
Breathe with your chest.
I know, who breathes like that? So on this side, I'd be looking for the spleen edge. And there it is. And then is there any pain or tenderness?
No.
So right here, I'm gonna go ahead and kind of push up back here, and I'm looking for the kidney. And then same with this side. And then right here, I would be looking for the distending aortic, AAA. And there it is. And then over here, we would be looking.
Mom, I folded
sorry. Right here, we'd be looking at the inguinal hernia. Sorry. The inguinal hernia, and I do not feel anyone. And I would also be looking for the, oh wow, it's good and strong. So here's the inguinal hernia, and then if she had one, it would be right here. And then right here, these are gonna be both her pulses. Her, I know the name of the pulses, I just cannot think of their names. So, the femoral pulse. And then, and they're both good. Rhythm, rate is strong. It isn't bounding. It's probably a +2. Feels great. She has really good pulses. Really good color all over. And then, of course, after we auscultate, we palpated, and we need to percuss. So, and it sounds totally different than the lungs. You could probably hear it on there. But basically, it just sounds, you know, I want to say squishier, but it sounds different than the lungs. These have like an airy sound, and this has more of like a moisture sound. I don't know how to say that differently. But then, so we're here, and we're gonna look at the iliac crest right here, and we're looking for the bone, the tip of the bone. And there it is, and it feels good, feels stable. And then I'm gonna go ahead and have you lift up your knee to your, go ahead and hold your knee up there. Actually, here, let me do it first, and then you can do it. Do it again. Okay, and then I would do the same on the other side. I don't want to cover up the camera though. Here, straight up. Okay, and then go ahead and take one knee to your chest, and then hold it down. Okay, and then the same with the other knee. And then we're gonna go ahead and, so she has good movement in her hips, and I'm gonna have you, well, first put your knee up, and then just fold out your legs. We're just testing, okay? And then that looks good. And then you're gonna do this. Put this one down, and you're gonna fold it in and out, and then this is gonna go down your shin. So do that with the other one. Okay, and your shin. Okay, and so since we're here, and I'll go back, but we have the pulse up down here. We're searching for both pulse there and we're checking for range of motion in her foot. Go ahead, push up, push down, and then same with your legs. Pull up, down. Okay, let's do that. Here.
Time's up.
Okay, and so now we are at this part of her body. So we've gotten all of the cranial nerves, her shoulders, her elbows. We looked at her kidneys and her spleen. Go ahead and turn up, and I'm gonna have you say 99 when I say to. Say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay, one more time.
99.
Okay, you can actually feel it. It's kind of cool. Okay, so I have I've looked for your kidneys, the left and the right. Breathe in deep. Do it again. It's symmetrical. My thumbs go out at the same time. Everything is symmetrical. There seems to be no lesions. She's healthy, young female. Now we're going to get to the walking. Go ahead and walk heel toe, heel toe. Okay, walk on your toes. Walk on your heels. Okay, you can just hop back. Okay, fun times. Okay, so balance seems great. That's also has to do with your acoustic, your balance. So now we were at the hips. She has good range of motion on her hips, and everything looks good there. Now we're gonna go into her thighs. Go ahead and lift up and pull down, pull down. I guess it doesn't work very well like that. Here, let's just do your pull down. Okay, pull down. Okay, push up. I feel like we already did this. Push down.
We did.
And so basically we're looking at the knee right now, and go ahead and lay back. I'm gonna show the knee a little bit. So we got the knee, and this is the patella, and then we have the medial. So inside there is the MCL, and then the LCL is over here, and then the we also got the meniscus is in the middle, and then the MCL goes across, and the LCL goes across, but the meniscus is in the middle on this side too. And then there's two inside underneath the patella, and this is the patella, and then there's the patella tendon right there. And then we have in the back behind the knee, there's two different tendons, and I know what it is, but the ACL, I'm not for sure. I know there's a tendon back there. I think it is the ACL. So we have the MCL, the LCL, and the ACL. And then inside there's there's another tendon other than the the ACL. So there's all of those tendons in each knee, and so when I move her up and move her over and out and in, it checks all of those, and so her knees are strong and there's not a lot of give, like she doesn't have a lot of play in there. And the same with the other one. So she's got, this one actually is a bit tighter than this one. See, there's a lot more play in this one compared to that one. So this one's a little looser And so, right here, then we go down to the, this is the guys, the Achilles tendon. The Achilles tendon is back here. And so I'm gonna just go ahead and do a sweep through of all of her tendons. So we'll start with this one up here with the brachial. So, and then we're gonna come up here and do loosen up.
I am.
Well, having a hard time with it.
Wait.
But it's there. There. Oh, okay. And then right here, we're gonna have you laid on your lap. And there. And then relax. There you go. And then we'll do the knee one right here. Well, there. We'll do this one. Wow, I had to hit that one kind of hard. Okay, and then we'll do the other ones over here. I already did this wrist. We're gonna go ahead and do this one.
You're holding my hand, Mom.
Well, okay, and then this one we would do right here.
It worked.
Oh, okay, well, I'll try. Anyway, so her reflexes are great. Her tendons are looking good. Everything is symmetrical except for her breasts. This is being recorded, so I would probably send her to either try her with birth control first to see if that helps make them more symmetrical. I know they're normally asymmetrical anyway, but one is a little more bigger than the other. So
You.
it's because of how my bra fits, but I promise you this one's bigger. Anyway, and then she also has a tattoo on her left arm, small. Okay. So now we've done the tendons, we've done symmetrical, we looked at your knee, patella, we looked at your legs. I'm gonna go ahead and I still think I need to do range of motion on some stuff. So we already did this. We did the pulse on top of your foot, and then we looked on the inside of the foot right here to see the pulse. And then of course that's the medial, and then this is the lateral pulse. And then of course that's the Achilles tendon. And then we look at the toes. The toes are looking groovy. One has an ingrown toenail, a little bit of redness, a little bit of swelling. I think it's healing quite nicely. Then she has like a scar on her middle toe, and the rest of them basically look good. Toenails look good. She gets her, when I do the check, the color comes back. The inside of her toes look great, and the pinky's a little red, but there's a little bit of scarring on this toe. You're supposed to push that back. Anyway, that's a cuticle. Okay, so these are all good. They have good range of motion. I squish on each one of them. The metatarsal feels good, and up here they have good range of motion. Toes up, toes down, spread them.
I can't do that.
You just did. Toes up, toes down, spread them. Oh, the other reflex I missed was this one, bloop, and this one, bloop. And then doing the let it hang. I'm gonna put my hand under here There we go. And then I'll put my hand under here. Is it loose? Yep. And then she also has a mole over here on her.
A birthmark.
It's a birthmark right here on her calf from childhood. So I'm just making sure. I did all of the cranial nerves. I did the shoulder. Just swing your arms. That's good. And I did that. I did the lift. Just push out